I'm Paul Roseno, and I work as a compliance specialist in OHA's hospital staffing program. OHA's hospital staffing complaint system is how Oregon's hospital staffing law, including the updates in 2023's House Bill 2697, are enforced in Oregon. In this video, we will provide an overview of the requirements related to staffing plan approval dates. Hospitals are required to adopt staffing plans by committee approval or, for some nurse staffing plans, using binding arbitration. It is helpful to include the adoption dates on every adopted staffing plan to ensure hospital staff and the OHA are able to identify the current plan and confirm timely plan adoption. The adoption date refers to the date on which the committee reviewed and approved the plan. For plans subject to binding arbitration, the adoption date is the date the arbitrator issues the plan. The most important dates to include in a staffing plan are the date the staffing committee approved the plan, the effective date when the staffing plan goes into effect, and for nurse staffing plans, the annual review date, which is the date when the nurse staffing committee conducted the required annual plan review. OHA also has a short video explaining the requirements for the annual review of the nurse staffing plans. In addition, the adoption dates should be included in the meeting minutes of the staffing committee during which the plan was reviewed and adopted. As discussed in the prior slide, a staffing plan should include an effective date which confirms when the plan goes into use. When a staffing plan is modified or updated, a new effective date reflects when the hospital transitions from using the previous plan to using the new plan. The effective date helps staff on the unit know the expectations for staffing on the unit and allows OHA to determine whether the unit is staffed as required by the plan. In addition, the effective date should be included in the meeting minutes of the staffing committee during which the plan was reviewed and approved. When a hospital updates its staffing plan, the changes often include revised minimum staffing levels or staffing ratios. This means that shifts in the future may have a different number of staff or different assignment standards. It is recommended that hospitals review and adjust any pre-scheduled shifts before implementation of a newly adopted or newly modified staffing plan so that future staffing assignments align with the requirements of the new staffing plan. Following this recommendation reduces the likelihood of complaints after the new plan takes effect and makes it easier for OHA to analyze whether the hospital complied with the statutory safe harbor provisions. If pre-scheduled shifts do not reflect the revised minimum staffing levels or ratios specified in the new plan, the protections offered by safe harbor may not apply. OHA has explained situations involving permitted deviations and safe harbor provisions in a video short available on the hospital staffing website under Hospital Staffing Videos section. During an investigation, OHA reviews the staffing plan that was in effect at the time of the alleged violation. For more information about hospital staffing requirements and hospital staffing resources such as FAQs, webinars, and hospital staffing shorts, visit the hospital staffing website at www.healthoregon.org/hospital staffing.